I'm Dr. Prakash Doshi. I'm Director of Trauma and Chief of Orthopaedics, Nanavati Super Speciality Hospital for past 25-30 years now. I've been actively involved in sports medicine and sports practice for the last about 20 years. I myself love a lot of sports. I've been playing actively squash and golf for past 10 to 15 years. What to say about football? It's universally one of the most well watched and well appreciated game. You will be surprised the amount of people who play football around the globe. It's close to 350 million. Wow, what a number. And if you look at the membership and people who watch the game on the road, on the ground, on the TV, which is close to 26 billion people. I don't think in any sport we have so many people watching one game at one time. Football, like any other game, has got its own share of injuries because it's a contact sport, and any contact sport, injuries are part and parcel of it. But as compared to football and game like soccer and American football, the injuries are much less if you are comparing with rugby or American football. The commonest injuries what we see are strains, fractures, head injuries. Least but not rare, we see even skin injuries. Now, if you look at the sprain, commonly involved body parts are knee and ankle, where you can have ruptures of the ligament, and the commonest ligament in the knee which can give way is a middle collateral or a ACL or an anterior cruciate ligament. The ankle can have partial strains and tear. Now if you look at the strain part of it, the commonest muscle which is strained is quadriceps, hamstring and groin. This happens because the type of activity in football is sudden stopping, sudden running from a stationary point, which causes this overstretching of the muscles. Now if you look at the fracture part of it, commonly involved is the knee, the ankle and the foot. In the knee, you can have ligament and fracture combined. Now if you look at the head injury part of it, commonly we do see when there is head-on collision between two players or accidentally a player hits the goal post. Now rarely, as I said, skin injuries are seen, especially small cuts and bruise, abrasions. But if there is a major fall, you can have severe laceration. So these are the commonest injury we see in football, and it's important, as I said, then part and parcel of the game, but it's important to stay fit, play well and enjoy the game.